I didn't think there would ever be a treatment that worked for me. So it's just really exciting to kind of start this chapter. Do you see this?
I love this. That's amazing.
It's set up for us.
Yeah. Oh my God, we have to plug this in. Plugged in?
Yeah.
All right.
Hi, I'm Sam, and I have nonsegmental vitiligo, and I'm using OPZELURA.
Hi, I'm Sam, and I'm a dermatology physician assistant, and I treat non-segmental vitiligo with OPZELURA.
But she's not my healthcare provider.
We're best friends.
And this is our OPZELURA moment on air.
What can you tell us about our friendship?
I guess our friendship just started because you had the same name as me and lived across the street, and I had no friends when I moved there, so
easy.
I figured we needed to be. But since then, I mean, we've been through so much together. Like
everything. This is one of our many birthdays when you went brunette.
Yeah, that was a bad idea.
Our matching Halloween outfits. Oh, look at your knees.
I know. It was like, it spread so
I don't even remember
much.
it like that.
Yeah, this is like when I first started noticing the vitiligo on my face like
You
that.
can see it right there.
Yeah.
Oh. So when it started spreading, what was that like? Especially being, you know, in like junior high and...
I remember being annoyed about it, but I knew that it was something I was gonna have to deal with, and my expectations were kind of set when I was in second grade that there wasn't anything that can really be done about it. But it's not so much that it really bothered me. I think it's just a condition that clearly separates you from other people. So when you're growing up and stuff, it's something that, you know, you're not like everybody else because of it, right?
Yeah.
So you want to kind of do something so that you feel
maybe
like
you just
everybody
don't feel like being asked about it that day. You know, you're like, I don't want to talk about why, like, I have spots on my face. You know what I mean? It's like, yeah. So you've always seemed pretty comfortable with your non-segmental vitiligo. So why treat it?
So I grew up with it. I kind of only remember having it. So I was really excited about an option to see what it would be like without it being so noticeable and kind of like living that way. And so it just is something that I wanted to try.
At work, we treat a lot of patients with vitiligo. Sometimes they come in for that because they've just noticed it and it's very distressing. And sometimes you just notice it when they're there for like a whole skin check. So you're checking everything, you're like, oh, did you know you have vitiligo here? And there's treatments for that. With using OPZELURA cream, we've had great results for some patients with non-segmental vitiligo. And I knew that it would be a great option for you. So I was really excited for you to see your dermatologist and get started with it.
So as part of my morning routine, after I wash my face, I'll apply OPZELURA. I like to keep it where it's easily accessible, so I'm able to fit it into my daily routine. And I take a thin layer like this, and we'll apply it to all the spots where I have vitiligo. So around my forehead, and I'll extend it down my neck, and around my eyes. And I'm careful not to get any in my eyes. And then I'll wash my hands.
When did you or someone else first notice pigment was starting to return? And was there like a particular moment?
My husband probably pointed it out. You could see on my chin, like almost like little dots of color coming back.
Did you track your progress in any way, like taking pictures or?
I probably took pictures almost daily in the beginning, but I knew that it wasn't gonna show up right away, but I have some for you. This is probably like week one when I first started. You can see like my whole face is kind of covered and down my neck.
Yep.
And then you can see kind of like the pigment filling in around my eyes and on my chin. And then most of my cheeks had already come back and my neck started filling in a little bit more. You can see like that whole side. Again, like I didn't think there would ever be a treatment that worked for me, so.
What has motivated you to stay on treatment?
The results have helped me stay motivated, and I don't even really think about it anymore. It's not like a chore. I have to do it. It's just part of what I do. And I have my check-ins with my derm every couple months, and you know, she's excited about it too. So I think it's just kind of, it's easy for me to stay on. I lived my whole life having the condition and thinking that it was only going to spread. And since I've been using OPZELURA, I've started to see this repigmentation, and it's just really exciting to kind of start this chapter.
Indication and usage. OPZELURA is a prescription medicine used on the skin, topical, for the treatment of a type of vitiligo called nonsegmental vitiligo in adults and children 12 years of age and older. The use of OPZELURA along with therapeutic biologics, other JAK inhibitors, or strong immunosuppressants such as azathioprine or cyclosporine is not recommended. It is not known if OPZELURA is safe and effective in children less than 12 years of age with nonsegmental vitiligo. Important safety information. OPZELURA is for use on the skin only. Do not use OPZELURA in your eyes, mouth, or vagina. OPZELURA may cause serious side effects including serious infections. OPZELURA contains ruxolitinib. Ruxolitinib belongs to a class of medicines called Janus kinase JAK inhibitors. JAK inhibitors are medicines that affect your immune system. JAK inhibitors can lower the ability of your immune system to fight infections. Some people have had serious infections while taking JAK inhibitors by mouth, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have been hospitalized or died from these infections. Some people have had serious infections of their lungs while taking OPZELURA. Your healthcare provider should watch you closely for signs and symptoms of TB during treatment with OPZELURA. OPZELURA should not be used in people with an active, serious infection, including localized infections. You should not start using OPZELURA if you have any kind of infection, unless your healthcare provider tells you it is okay. You may be at a higher risk of developing shingles, herpes zoster, while using OPZELURA. Increased risk of death due to any reason. All causes. Increased risk of death has happened in people 50 years of age and older who have at least one heart disease cardiovascular risk factor and are taking a medicine in the class of medicines called JAK inhibitors by mouth. Cancer and immune system problems. OPZELURA may increase your risk of certain cancers by changing the way your immune system works. Lymphoma and other cancers have happened in people taking a medicine in the class of medicines called JAK inhibitors by mouth. People taking JAK inhibitors by mouth have a higher risk of certain cancers, including lymphoma and lung cancer, especially if they are a current or past smoker. Some people have had skin cancers while using OPZELURA. Your healthcare provider will regularly check your skin during your treatment with OPZELURA. Limit the amount of time you spend in the sunlight. Wear protective clothing when you are in the sun, and use a broad-spectrum sunscreen. Increased risk of major cardiovascular events. Increased risk of major cardiovascular events such as heart attack, stroke, or death have happened in people 50 years of age and older who have at least one heart disease cardiovascular risk factor and taking a medicine in the class of medicines called JAK inhibitors by mouth, especially in current or past smokers. Blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, can happen in some people taking OPZELURA. This may be life-threatening. Blood clots in the vein of the legs, deep vein thrombosis, DVT, and lungs, pulmonary embolism, PE, have happened more often in people who are 50 years of age and older, and with at least one heart disease cardiovascular risk factor taking a medicine in the class of medicines called JAK inhibitors by mouth. Low blood cell counts. OPZELURA may cause low platelet counts, thrombocytopenia, low red blood cell counts, anemia, low white blood cell counts, neutropenia, lymphopenia, leukopenia. Your healthcare provider may do a blood test to check your blood cell counts during your treatment with OPZELURA and may stop your treatment if signs or symptoms of low blood cell counts happen. Cholesterol increases. Cholesterol increase has happened in people when ruxolitinib is taken by mouth. Tell your healthcare provider if you have high cholesterol or triglycerides. Before starting OPZELURA, tell your healthcare provider if you have an infection, are being treated for one, or have had an infection that does not go away or keeps coming back, have diabetes, chronic lung disease, HIV, or a weak immune system, have TB or have been in close contact with someone with TB, have had shingles, herpes zoster, have or have had hepatitis B or C, live, have lived in, or have traveled to certain parts of the country, such as the Ohio and Mississippi River valleys and the Southwest, where there is an increased chance for getting certain kinds of fungal infections. These infections may happen or become more severe if you use OPZELURA. Ask your healthcare provider if you do not know if you have lived in an area where these infections are common. Think you have an infection or have symptoms of an infection such as fever, sweating or chills, muscle aches, cough or shortness of breath, blood in your phlegm, weight loss, warm, red or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinating more often than usual, feeling very tired, have ever had any type of cancer, or are a current or past smoker, have had a heart attack, other heart problems, or a stroke, have had blood clots in the veins of your legs or lungs in the past, have or have had low white or red blood cell counts, are pregnant or plan to become pregnant. It is not known if OPZELURA will harm your unborn baby. There is a pregnancy exposure registry for individuals who use OPZELURA during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. If you become exposed to OPZELURA during pregnancy, you and your healthcare provider should report exposure to Insight Corporation at 1-855-463-3463 or www.opzelura.pregnancy.insight.com. Are breastfeeding or plan to breastfeed. It is not known if OPZELURA passes into your breast milk. Do not breastfeed during treatment with OPZELURA and for about 4 weeks after the last dose. After starting OPZELURA, call your healthcare provider right away if you have any symptoms of an infection. OPZELURA can make you more likely to get infections or make worse any infections that you have. Get emergency help right away if you have any symptoms of a heart attack, blood clot, or stroke while using OPZELURA, including discomfort in the center of your chest that lasts for more than a few minutes, or that goes away and comes back. Severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw. Pain or discomfort in your arms, back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Breaking out in a cold sweat. Nausea or vomiting. Feeling lightheaded. Weakness in one part or on one side of your body. Slurred speech. Swelling, pain, or tenderness in one or both legs. Tell your healthcare provider right away if you develop or have worsening of any symptoms of low blood cell counts, such as unusual bleeding, bruising, tiredness, shortness of breath, or fever. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of OPZELURA in people treated for nonsegmental vitiligo include acne at the application site, itching at the application site, common cold, nasopharyngitis, headache, urinary tract infection, redness at the application site, and fever. These are not all of the possible side effects of OPZELURA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Insight Corporation at 1-855-463-3463. Please see the full prescribing information, including boxed warning and medication guide at opzelura.com.